Good day everyone, welcome back to my channel. Today we're talking about important things to know about emergency contraception. First, we'll talk about contraception. This is the act of preventing pregnancy. This can be a device, a medication, a procedure, or a behavior. This is a way a woman can control her reproductive health and also be actively participant in her family planning. So this is a way of controlling pregnancy and a way of preventing pregnancy. But they'll be focusing only on emergency contraception, which can be morning after pill or copper IUD. Now, how does ECP work? How does emergency contraceptive works? It works by delaying ovulation, which is the release of an egg during your monthly cycle. But if fertilization and implantation have already happened, ECP will not interrupt the pregnancy. Which is, if you're already pregnant, ECP cannot stop you from getting pregnant. But if you use it after sex, it will prevent you from getting pregnant. But when you delay and pregnancy occurs, ECP cannot stop the pregnancy. Now, how well does ECP work? Out of 100 women who take ECP every year, about 1 to 2 will still get pregnant after taking it within 72 hours of sex. Now, ECP can only work when you take it immediately after unprotected sex. That's why being called morning after pill does not mean that you have to wait till the next morning before you take it, because if you wait or if you delay, ECP will no longer work for you, making it inactive. But when you take it immediately after sex, after unprotected sex, it will help to prevent pregnancy. And people ask this common question, like, does it mean that if I'm taking ECP, will it really prevent me from getting infections or STD or STIs? No, it will not prevent you from getting STDs or STIs, because you still need condom for that. Despite you taking pills to prevent you from getting pregnant, you still need protection for STDs and STIs. Now we're talking about the side effect of ECP, side effect of emergency contraception. First, we have nausea, we have vomiting, we have breast tenderness, we have headache, spotting, and change in menstrual cycle. Sometimes you can notice that your menstrual cycle has changed or there's a delay in your period. This might be as a result of ECP. So don't panic. Whenever, if you're like having doubts, go see your doctor for more clarification. Now we'll talk about who can use ECP, who can use emergency contraception. First, people who don't use condoms for sex and when a cervical cap slips out of place during sex. Also, young women who have forced to have unprotected sex are the ones who use ECPs. Now we'll talk about people who can use ECP. First, pregnant women. You can use the ECP if you are pregnant. So when you notice that you're pregnant, you can use ECP, and you can use ECP as a regular birth control method. It's only used for emergencies. So using it as a regular birth control method is wrong. It's only used as emergency, and it cannot be used by pregnant women. Another thing we're talking about today is, where can you see ECP? Where can you actually get an emergency contraceptive pill or a IUD for emergency? You can get it in any pharmacy or drugstore without prescription, but there's a particular type of ECP that you need prescription to get. The ones that are still active after 5 days of unprotected sex, those ones you need a prescription to get it in a pharmacy or drugstore. But the ones that are active within 72 hours of unprotected sex, those ones you don't need a prescription to get it. Then an emergency IUD, which is an intrauterine device which is used for emergency contraception. Those ones are only available with your doctor or your nurse practitioner, which can only be done in your doctor's office or in a health clinic. So those ones are only done by doctors and health practitioners. Finally, we're talking about when you need to see a doctor. First, when you might be pregnant, when you notice that you might be pregnant, that's when you need to see a doctor. When you notice that the ECP you took is not working, you might be pregnant, you need to see a doctor. When you have unexplained fever or chills, when you have belly or pelvic pain, when you have pain during sex, when you have pain during sexual intercourse, you need to go see a doctor, because it might actually indicate something more severe or something more serious. Now, when you have heavy or long-lasting vaginal bleeding, you need to see a doctor if you're having vaginal bleeding, which is not your period. Or when you have abnormal bleeding, you need to see your doctor. When you miss your period within 4 weeks of using emergency contraception. So when you realize that after using ECP, you've not seen your period, you need to see your doctor. And it's important to know that COCPs can be used as ECP, but it depends on the type of COCP, that is a combined oral contraceptive pill. It can be used as ECP, but it depends on the type, and it's not that effective like ECPs, which contains only progestin only, and the IUD. So COCP are not that effective for emergency contraception, but the normal ones which contains progestin are the ones that are more effective. So thank you so much for watching. Don't forget to like, comment and subscribe. If you have any question, if you have something to add, please drop it on the comment section. Thank you.